we play these games, computer? Come on. There we go. Hi, Mist. Alrighty. I hope you all had a great Friday. I know I did. I'm just glad it's the weekend. Let's see. So we're gonna wait a few minutes, give people a chance to get in before I start talking. If y'all have any questions, make sure you leave them in the chat and I will get to them because this is an open chat tonight. I am going to go over probably some more things about the AHIMA program online, learning independently, because a lot of people still ask me about it. So I'm going to talk a little bit more about it tonight. Yes, Fridays are like that. Missed. They are busy days. Oh my gosh, it's Jerry. Hi, Jerry. Thank you for the blue heart. Well, it's here. It's here. And I try to, of course, you know, my lightheartedness. I always giggle in my videos. Some videos are a little more serious than others, but, you know, I'm here now. Hi, Blanca. I hope you're doing well, Jerry. It's been a while since, I guess, since we've had a live and we've been here, so. All right. Hi, Mitney. I'm doing great. Thank you for asking. So we're going to give folks a couple more minutes so we can get this party started. Like I said, I only have the thing about AHIMA to talk about tonight. Okay, that'd be great, Jerry. Thank you so much. I'm only going to talk about AHIMA, I guess, and so if you guys have any other questions, of course, ask away. I didn't really have a topic prepared because the last time I prepared a topic, there were so many questions that I got, so my topic kind of went to the side. So that's why I'm just kind of like, okay, well, I will let the viewers take control of the live. So, hi, Pamela. Thank you for joining me. I am almost at 20,000 subscribers. I'm like 400 away, a little over 400 away. I'm very excited and very thankful, very grateful. This is a journey to, be a YouTube creator, content creator, and it's nice to see those little numbers going up because, as you guys know, I do not do all that SEO stuff and all that other stuff. Oh, boost your ratings. Oh, please, no. People will watch you if you let them. And if you put out quality content, if you put out good content, they'll be there, And some things I say people may not always want to hear, but at least you know it's the truth, So, at least there's that. So anyway, I guess we'll go ahead and get into it. We have a quorum now. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, tonight I am discussing a little bit more about the AHIMA online medical coding program for learning independently medical coding. If you are a nurse and you are looking to study medical coding and you don't know what program to go with, HEMA does allow you to purchase courses a la carte. So you can just purchase a course at a time. Some of the online courses allow you 6 months from the time that you purchase. Others will allow you 365 days. So if you're purchasing them separately, individually, it is a little bit more expensive. But what do you expect? But you do get to set your own pace. So if you wanted to purchase the anatomy and physiology course, you can take as long as you wanted on it, instead of purchasing the 13 course bundle where you're really looking at completing a course like a month a course, a little over a course a month, rather, because it's 13 courses. So just a little over in order to complete that whole program. Some people will buy the whole package because even though you are a nurse, some nurses know what I'm talking about. Others are just like, what do you mean? So some nurses do need a refresher. Depending on how long ago you went to school for nursing, sometimes you just need a little bit of a reminder. There are some things that you can forget. I have recently revisited pathophysiology, and trust me, there's a lot of things that I remember about patho, but there's a lot of things that I was like, whoa, I forgot a lot of this stuff. But it's more of like the cells and all that other good stuff. So with that in mind, you want to make sure that if you know you need it, and there's no harm in it, there's no shame in needing a refresher. If you are a nurse in anatomy and physiology, there's really no shame in it. So if you want to go ahead and purchase that additional course, you can. And a la carte, they're still very reasonable anyway, and so you're able to not have such a time constraint when you are, working these one at a time. And as you complete one, you can purchase another one. And so it makes it a little bit more affordable that way, especially if you are, in a situation where you don't have a lot of money, but you do have some money to get started. You can purchase those courses one at a time. I also do have the independent study list. Now, I say I have the independent study list. There's an independent study video, and I don't know if people are hearing me. I have a video, and I always attach it in all of my latest videos for like the last year. You will see as you scroll down, and when you read into the description box, independent study video, and that has all of the books and all of the timeline that I recommend for studying medical coding on your own. All of the resources are there. This is free. This is on my channel. And so people I don't know if they're not thinking about it, or they just don't know if they could or not. A lot of these things are free. You can start off with like downloading the coding guidelines and looking at those and starting to get familiar with that. And then as you go along, you can build on all of the things that you need. Anatomy, medical terminology, pathophysiology, none of that changes, guys. None of that changes. You can go to the public library and make fun of how I say library all you want to. But go to the public library if it's open in your area and look up a anatomy and medical terminology book and get to studying that way. You don't have to exhaust so much money trying to get into a new career field, especially one like medical coding. Medical coding is very unique in that you don't have to be a college graduate. You don't have to have a degree in order to pursue this field. You don't even have to come from a background of medical in order to be successful in this field. It is really on the individual. Medical coding is very much independently driven. It is very much independently learning and using resources. That's why I have them on my channel, and I still get questions, and I'm like, I've stopped responding. So if you're asking a question and I'm not responding, there's a good chance your answer is going to be in the description box of the video. And so that way, look there, look in the description box, because guys, I get tons of emails every single day. YouTube is not the only thing that I do. I also have a Patreon audience. I also work a 40-hour-a-week job. I also have other things going on in the back that I do not bring to the channel here. So there's a lot of things that I have to be able to manage my time. And having questions, that are there in the description box, or literally in the video. I talk about it. Guys, that's what I'm telling you. There's your answer right there. Hi Charla. My name is BLEU. Hi Tangela, thank you for the blue heart. Hi Sabrina, the highlight of my day. Hi Blue. I'm talking to you from the ER. Oh no, I hope you're okay. Or I hope whoever you're with is okay. Oh my goodness. The ER is no place to be on a Friday night. Hi Alma. So I hope you're okay. But going along, I just want you guys to know that it's a very rewarding field when you start to study it, whether you are a nurse or whether you are recently retired and wanting to start a new career. Medical coding offers that home, if you will. Sabrina. Oh, wow. Okay. Hi, Liz. Thank you for joining me. So if you are in that time of your life and you want to start something new, it's going to take a lot of discipline, guys. I talk about the discipline that it needs, that studying medical coding needs, and I don't think people understand what I mean when I say this. You have to make the time to study. It's not an all-encompassing thing, because I've gotten that question before too of, do you mean we have to study 24 hours a day, 7 days a week, and we get no time to ourselves? I have never said that, but believe it or not, somebody asked me that. No, guys, whenever you're learning something new, particularly a new language like medical coding, it's going to take time to learn. You just have to dedicate the time to learn. But if you want to do it, you absolutely can. I managed to take and pass not one, but 2 credentials last year from AHIMA. I took the CCSP and the CCS, and I passed them both in the first try. So, but it took everything that I had to make sure that I'm keeping up with everything too. And I never want to let you guys down, because, you know, I know how it is to be an adult, and, you know, hey, how do we do this? And so I don't ever want to let you guys down. That's why I always try to be very consistent with you all. Clara, hi Blue. I don't know, for a HEMA exam, your books can't be tab except for CPT. Again, let's talk about the tabs, all right? In the, what is it? The candidate guide for a HEMA, right? It says that the tabs have had to have come with the original book. So the only one on the approved book list that comes with tabs that you could put on is a CPT manual from the AMA. Yes, you can use those tabs for that one. However, on the ICD-10-CM book, the Optum 360 book does not come with the tabs that you can put on. It comes with the inserted little divider thingies. If you are using the tabs, I'm telling you now, that tells me as a veteran coder that you have not been using your book enough to get that practice. These are timed exams. It is roughly 2 minutes per question on AHIMA exams. Roughly 2 minutes per question. Now keep in mind, it's multiple choice and it is a case studies. So you have to be able to balance all your time out. Clearly you're not going to spend 2 minutes per question when you're on that multiple choice part. But when you are on the case studies part, you're going to have to take a little bit more time, because you're going to be reading that stuff. So that's why you have to make sure that you pace yourself. If you're fumbling around with these books and you still have tabs, again, you need to work on your speed and work on your knowing the book itself. If you have been opening the book and going through the book like I've been telling you guys to, I've always said to take at least a Saturday and open the book and get familiar with the sections. As you do that, your need for these tabs is going to go away, because tabs do 2 things. They tear your book and they get in the way. And again, with AHIMA, now AAPC is different, but AHIMA, this is what I'm talking about with AHIMA. AHIMA is very particular because they have a third-party test person that does theirs, which is Pearson VUE, and they will inspect your books. They will make sure that there's no sticky notes in there. There's no tabs where they're not supposed to be. I have taken all 3 of my AHIMA exams. I took the CCA first a few moons ago, and I had no tabs. And I was never a coder at the time, and I, had just been fresh out of school. Okay, for any of those who said, "Oh no, you had experience." Oh no, ma'am, I did not. And then with the CCSP and the CCS, I did not have tabs on any of my books. So if you are studying like you're supposed to, you won't need the tabs. You also will not need notes. People ask me, well, what about the notes? How do you write your notes in the book? I never write notes in my books because your books are not meant to be workbooks, and they're meant to be reference material. And because of that, you want to work with a clean book because you don't want a book that's been written all over. You don't know what's going to be on that test, and you're not going to have time to read your books. And for people who say, well, I want to create my own tables in the book, can I do that? Why would you do that when the book already has the answers? Get familiar with the book and the way that it is so that you don't have to create your own tables. If you want to create your own tables, do it in a notebook. Don't do it in your book. Because I certainly would not want to risk all the money that you have to spend for these exams because, when you get to the test center, well, you can't use that book because it's got too much writing in it. Or you can't use this book because it's all tabbed up. You're going to have to take those tabs off. And sometimes they'll tell you that, and sometimes they'll be like, okay, well, you knew the rules. Because the candidate guide specifically says, unless those tabs came with the book, you cannot have homemade tabs. And I even had somebody from the community college, he's a professor at the community college, yell at me in an email. And he was like, you're telling people that they can't be tabbing these books when I've already told my people that they can. Did you read the candidate hand guide, sir? If you did, then you would know that you're telling your people wrong. Don't set your people up to fail. I'm just saying. Liz says, Blue, how do you keep up with the NCCI, NCD, and LCD edits? I passed my CCA, congratulations, but didn't finish all my questions. Ooh, you did really good then if you didn't finish them all. Good, I'm glad, Clara. So the National Correct Coding Initiative is the NCCI. How do you keep up with that? So there's a thing called Coding Clinic, and there's CPT Assistant, and all of those things. So as people write in for advice, and all this stuff gets cataloged into CPT Assistant and Coding Clinic, and so there's a lot of things that come up with NCCIs. Those edits, right? They're going to make sure that you're not like putting extra things where they're not supposed to be, or reporting too many, or reporting the wrong quantity and things like that. So you can always go to CMS and look those up, but it's not something that you have to like hard and fast study. You have to know what it is, you have to know where to find those answers, but it's not something that you have to go through and overwhelm yourself. I'm always very careful about telling people about NCI and NCCI and LCD and NCD. And a lot of people will use NCD, LCD as a buzzword. Again, forget about it, guys, because when you are in the workplace, you will know, okay? And again, you can always reference the CMS website, cms.gov, for all of that information about those things. They have the updates every year, and they have them posted for free that you can download all over CMS. So be sure to check that out. But it's not really something to get like all worked up about, when it comes to that kind of stuff. And a lot of times, like the encoders are very helpful in this kind of stuff too. So if you have like a quantity issue, there are a lot of encoders that have those flags that will tell you. So Liz says, LOL, thank you for that information. I've been stressing about that. People act like they memorize it. Oh no. And let's talk about that too. People talking, right? And acting like they know and they don't know. All right. So here's the thing. When it comes to your competence and how you know things, right? Just because you know a particular specialty, it doesn't mean that you need to immediately run out and go and get a credential, and that's going to make you an expert in that particular specialty. I've seen people with those specialty credentials not know a hill of beans when it comes to those particular specialties. So what people are saying is different from what they actually know. And just because they have a little tag on their name doesn't mean that they know everything. This is why I'm always suspicious of people who have a whole alphabet after their name. Oh, I'm ready for my alphabet soup. But at the same time, if I ask you a question, you can't answer me because you don't know. I have 2 credentials. I don't even have a degree yet. And at the time before, I only had 1. I had the CCA. The CCA that everybody says, oh no, that was a CCA. Rah, rah, rah. Really? I've trained nurses. I've trained doctors. I've trained other medical coders. I've trained my supervisor in the past. Oh, yes. I've been able to do that, and I had my CCA. The competence is on the coder. You can be extremely competent and have 1 credential. You can be extremely competent and have 2. You can be extremely competent and have a degree. But just because you have a bunch of letters and you have a mouthpiece where you're just talking and telling people and scaring people into saying that you need to know NCD, LCD, no. And I see that NCD, LCD on a lot of those medical coder resumes, like the templates that you see out there. And whenever I see those on LinkedIn, I'll see that same template and I'll see a bunch of people posting those same things. You know, that's not what employers are looking for. The things that employers are looking for is specifically in those job listings. And a lot of times you don't see NCD, LCD in there. What are you seeing? Candidate must have medical terminology, anatomy and pathophysiology, and all the other things. They need you to know that. They're not concerned about all this other stuff. They need to know that you know all these medical terminology, anatomy, and patho. Why? Because they want to make sure that you know that you're competent enough to be able to read what you're trying to work through. All that other stuff doesn't matter. It does matter, right? But it's not as critical as your base foundation, which is that medical terminology and anatomy and patho. And again, don't underestimate it. Don't underestimate the power of knowing all of that stuff and the continual practice that you're going to need to. I say this all the time. We have to know what doctors know while never having gone to medical school. There was no truer saying. And I said it since I started the channel because it's true. We have to be able to understand what they're saying. When they come out with all this medical jargon, you got to be able to, okay, I got this. You know, they're not going to say bruise. They may say ecmosis. They may say all these other things that mean different things. Contusion. They may say a lot of the same things. And if you don't know the language, you're going to be confused. And then you may pick up codes that don't even apply. So that's why it's going to take time to learn. Once you pass your certification, this is just the beginning. The studying still needs to continue, and working through workbooks like I've mentioned before, the ICD-10-CM and ICD-10-PCS coding handbook with the answers, working through AAPC's study guide as well, the CPC study guide. I believe in that book and I'm all the way with a HEMA, and I believe in that CPC study guide. Now, there are a couple of questions in there that I didn't really agree with their answers. But that's okay. For the most part, it's enough to get you started, and it's enough to get you going and not overwhelm you. They did a very good job on that book, and I will always recommend that book. Do I have it right here with me? Yes, I do. I will always recommend this book, whether you are sitting for a HEMA or AAPC. And I know some people, or they're like, Blue, that's not even the same organization. But it's testing you on the same thing because we all get tested on CPT, right? So if you have this book, and yes, this is a 2019 book, but you know what? The same questions that are in this book are also in the 2022. You know what the difference is? Cost. Again, let's use our head, right? The cost is so much more expensive. It's $100 and something, right? For a brand new CPC study guide. This one, you can get it for like $10 on abebooks.com, abebooks.com. You can find this exact one for like $10. I think I've seen it one time for $7, and that was with the shipping included. And here's all the questions, and it's got the answers in it too. Now, if some of the codes have updated and you don't see those codes in your book, that's how you know, okay, that code was updated. So then I can look at what is the equivalent of the code that's needed there. Now, this is what I recommend because this is what I use to help me. Now, I got an email from somebody who says, oh, my friend says not to use that. Okay, who cares what your friend said? I'm telling you what I used and what helped me and what is very straightforward and simple to understand. Now, did I need as intensive workout in CPT? No, because I'm an outpatient coder. I've been an outpatient coder for 13, 14 years now. And, so I didn't need as intensive, but I still needed that refresher because you never know what was going to be on these tests, right? The CCSP or the CCS. So I wanted to make sure that I touched base on everything. And that was the book that I used to cover the CPT side. Everybody uses the same CPT manual. That book has really good questions. It's got a really good breakdown. I like the way that they talk about the anatomy as well. And they talk about like all these other keywords you need to know. That is an excellent book for study, whether you are sitting for an HEMA or, of course, an AAPC exam. Hi, Regina. Thank you for joining me. Liz says, I wonder why the CCA doesn't get props it deserves. Ignorance. That's why. That test can be just as challenging as the rest, if not harder. Trust me, if not harder, because it's got more domains. Z Marie says, hi, Blue, you're live. It's the highlight of my Friday night. Oh, thank you for the blue heart. Yes, I have been looking forward to this all week. I was like, oh, I get to talk to my people. Because, of course, I always pre-film the shows, and it's like, okay, I'm good to go this week. And then I said, oh yeah, and I have my Friday live. And so I started to do the little thumbnail to like promote the show. I like to use a little black cat ever since it was Friday the 13th that I did that bonus episode. I was like, oh, I like the black cat. So that's why you see the black cat again. I did 2 different thumbnails because I couldn't help myself. So, but yes. So don't compare yourself to other medical coding students, and don't listen to them when they say, oh, that's not good for that, because that's not the same organization. We're still being tested on the same material. Okay, this is why I say, even if you want to look at like medical terminology and then have one for nurses or whatever, if you want to look at that one, that's okay. I don't really like to promote the ones that say for like nurses or medical terminology for medical coders. Because you know what that is? That's a sales gimmick. That's literally taking a book and slapping medical coder on it. And now you have a captive audience. Oh, it's for medical coders, so I got to get that book. Versus another one like by Barron's or somebody that would be just as good, if not better. So it's not specific to. There's no specific medical terms that medical coders are using. Medical coders have to know all medical terms. And if not, we got to be able to look it up. So depending on a book that says medical terminology for medical coders, come on. That's just literally like a sales gimmick, because it's literally the same thing that you can get in any other medical terminology book or even anatomy. Infinite says, hi, Blue. Thank you for all the blue hearts. Watching you while I'm driving on my way home. Ooh, well, safe travels on the road. Wow, I got one on the road and I got one in the ER. Wow. This is a full house tonight. Wow. So, but yes, that being said, make sure that you are looking at all the materials that you can to get you as familiar. Don't listen to other people and what they're saying. Please stay out of those medical coding, those Facebook medical coding groups, because they are the viper's nest and the pit of negativity. I don't care what group you're in. There's always going to be some element of negativity in there. And sometimes, especially when you're brand new, it's really easy to kind of get sucked in to that negative thing because you don't know anything else. All you know is what somebody is saying. And if that person either has a credential already, or maybe they don't, or maybe they got theirs and they can't get a job yet. I've talked about this week about being on LinkedIn and complaining that you can't find a job. Guys, don't do it. Please don't do it. I've removed a connection because of this, and because I was tired of seeing it. And I can understand and I sympathize with people who are brand new and trying to get a job. I do, because I was there, and I was very desperate as well, trying to get out of cleaning houses and working on the weekend and working at a halfway house and working as a bartender where people talk to you all kind of crazy ways and you have to take it with a smile because that's what you do. That's your job. But I wanted to get out so bad. And everybody was telling me no, because in this industry, they want you to have experience because they don't want to have to train you. When in actuality, the amount of training on a coder who is brand new with no experience is probably a lot shorter and a lot less than a veteran coder who is coming in with, yes, experience, but not always the best habits. You know, sometimes veteran coders get sucked into their own old habits and, oh yeah, we did this at my facility over here. But what works at your facility may not work at this facility. And so sometimes it takes a long time to kind of undo those bad habits. So again, you know, new medical coders have a lot to offer, just like CCAs, certified coding associates, have a lot to offer. But because, you know, they have a bad rap, oh, well, that's just entry level. You know, I had CCA for many years. And I will always advocate for the CCA. There's nothing wrong with it. And people say, well, no one asked for it. Yes, they do. A lot of times people are not looking in the right places when they're looking for jobs. And even if they're not asking for your credential, you can still apply anyway. Because if they're desperate enough and they give you that entry assessment test and you can pass it, you know, there you go. Some employers will say, we'll hire new graduates, you know, but you have to have your credential within a certain amount of time. And that's reasonable. Because, you know, some people just get lucky that way. I mean, that would be nice if all employers were welcoming like that, but it really depends on leadership. And that's why I say it takes good people to get into this industry. I always advocate for the leaders who are watching the channel, the people who are in the RHIT, in the RHIA programs, that when it comes your turn to be hiring people, that you be conscious of hiring people who have no experience. You know, but I also believe that people who have no experience also need to bring their A game. Because as I have said, the person that I had to remove the connection with had a terrible resume. And it was a terrible resume and it was thrown together and there was a lot of repeats and administrative support, office management. What the heck does that have to do with medical coding? Why aren't you highlighting your medical coding training? It is your skill when you have the training. Well, people say, well, I haven't done it before. It doesn't matter. You still were trained. You can still put that on your skills list, that you have medical terminology, anatomy, pathophysiology, and you don't have to quantify it with excellent medical terminology, moderate, you know, anatomy. You don't have to quantify it. When it's there on the skills list, that's your skill. If you put team player, get it off of there. No one cares. On your skills list, it needs to be all of your hard skills. What software do you know? Is it Microsoft Office, Outlook, Word, Excel, PowerPoint, or is it just Outlook, Word, and Excel? Don't put Microsoft Office Suite. No one cares. Specifically, what do you know about that one, right? And do you know basic mathematics? Believe it or not, that's also in those job listings as well, even for medical coders, because basic mathematics is needed. It's not going to be any kind of crazy formulas, so just calm down. I always get people hyperventilating. Blue, I didn't know it was going to be. Math, very minor, if anything. Plus minus math. Literally very easy. It's not anything hard. So, but the majority of what we do is medical terminology, anatomy, and all that good stuff. So that's the things that you want to add on there. Not a good communicator. The only thing you need to put about communication is what language do you speak. If you only speak English, put language fluency, English, excellent written and verbal. That's it. If you are bilingual, you need to put that on there. And people ask me too, Blue, why do I need to put that I'm bilingual? I mean, who cares? Trust me, that might edge you out over somebody else because you never know who that facility is supporting, Who are they serving? What type of community are they serving? Are they serving a bilingual community? Then okay, hey, we just hired a brand new bilingual medical coder. Oh, good. So maybe they can answer this patient's question about, like, whatever they're trying to ask, or whatever, or if you need to do that. Not that you're being hired as a translator, but it does help that hey, we know somebody who knows this. It's always good to have people who are well-rounded be in these positions. If you have that extra language, go for it. Write it down. Put it on there. If you speak Spanish and English, Spanish and English. If you speak any other language, you can put it on there as well. There was a lady who commented, she's like, you're so right, Blue. She goes, that was how I got into billing. She spoke conversational Chinese, and there was people that were trying to pay, but they spoke Chinese, and there was nobody there could help. But they knew this lady could speak Chinese, and she worked in a different department, and then she was over there, and she was able to help. The patient was able to pay their bill, and boom, now she's working as a biller, and she's moving on to getting her medical coding certification. That's what it takes, folks. You got to start talking. You got to tell your skills. If you're not sharing your skills, no one's going to know, right? No one's going to know. And if you are looking at, like, well, I came from, I was an MA, or I was like a medical assistant, or I was home health, I did that kind of stuff. Don't tell me about that you bathed the patients or that you fed them and things like that. Say the specific things that can be transferable, that you documented how much food the patient ate in ounces and that kind of thing, or whatever, or percentage of the food that was completed on the plate, or that you protected their private information. Those things are transferable to medical coding. If you had to organize things, if you had to use Excel spreadsheets, if you had to use Word, if you had to do any of those things are transferable. That's what you want to talk about on your resume. And you only want to go back 10 or 15 years. Don't go back to 1998, guys. Don't do that. 10 to 15 years, because that's as far back as they're going to run you. And it doesn't matter that you have a history that goes back that far. 10 to 15 years, max. Liz says, Blue, I think you mentioned Crash Course for A&P before. Yes, I did. I totally agree. It helped me pass my A&P course last year. Hank is amazing. I love that channel because they're 10-minute videos, like 10 to 15 minutes, 13 minutes for some of them. Very concentrated, and they're very animated as far as like how they talk, so you're not falling asleep. Trust me, I've seen those that like you're just falling asleep because you're just like, oh my gosh, this is so boring. But Crash Course is amazing for that. Liz says, true, you need math for lesions. There you go. And so those are the things that I think people don't think about. It's the detail stuff. That's why I talk about detail stuff on my channel. Another Liz says, the resume tips have been amazing. Yay! I'm embarrassed to say, oh no, oh no, Liz, I'm sorry. My resume had the hard worker and team player after finishing medical assistant program. It's okay. You didn't know. No one talks about this stuff, right? No one talks about this stuff. And you see a lot of the same things being said as far as like the same rigmarole type deals, But it's funny because the other night I had said, if you're posting your resume on LinkedIn for everybody to see, the world to see, don't put your home address, because you got to practice safety, right? You're putting your home address and your phone number, and this is for the world to see. Now, not only that, they've got your home address, your phone number, they also have your work history, right? They also have your credential, like wherever you went to school and things like that. All your personal information. And Lord knows what they can do with it. Let's be careful out there, folks. So I said, don't put your home address. You can put your city and your state. And I recommended even not putting your phone number. You can put your email address where they can contact you. They don't need to call you. They can email you. It's just as easy for them to email you. And wouldn't you know, I was going through, it's on my feed anyway with Instagram. But it was an Instagram, and it was saying, the girl was saying, don't put your home address. And I'm like, thank you. Somebody else is saying it too. Because don't put your home address. You never know. There's people out there that have bad intentions, you know, and I hate to say that, but there's some people out there who have bad intentions, and they will do things, and it's a scary thing out there. I'm just saying. Um, Liz said this was a few years back, but still, it's okay. We all learned. Even I have gone through some of my times where I'm just like, okay. Now I look at some of the first resumes that I did, and while they're good, they're still very good because those people were able to get jobs. I said, okay, well maybe I might have shortened it a little bit with like as much bullets, you know. And I'm like, okay. And so you get refined over time when you're writing resumes, and I love writing resumes because to me it's like you're a part of somebody's journey. And this is why whenever I do resume rewrites, I meet with the people so that I can kind of get a feel for what they want and what it is that they're after. Because it's not always evident in the resumes that you get, because people like, I don't know how to write a resume, right? And they're just like, this is what I have. And so what I use with their resumes that they give me is like, I use it to flesh out their what they did, you know, where their timeline of their jobs. And when I talk to them, a lot of times I'm drawing out a lot more things that they didn't think about. And so it's always nice to get those follow-ups and Blue, I got the job. That oh that melts my heart every time. Liz says, wow, great information. I never thought about that. Yeah. And like I said, it's sometimes you don't think about these things, and it's not always something that you have, it's like right on your mind, you know. So, you know, but that's what I would say. This is tea, by the way. It's too hot for coffee. We've been having 100-degree days for like 3 months now, straight, here in Texas. Yeah, no fun. No bueno. But I am looking forward to the fall. If it gets cold, like chilly, like normal, not like where it tried to kill us a couple of years ago, like last year when we had that horrible ice storm here in Texas. So no, not that extreme. Yes, that exact emoji face is how I'm looking every day when I go outside, because it's like a heater just like blasting all day long. It's crazy. I don't do well with heat either. I try my best to stay hydrated, to stay under the shade whenever I'm walking anywhere. I use SPF 100, which is why I have not burned at all. And I used to not wear sunblock. I know, it's big taboo, right? Don't wear sunblock. I'm like, really, Blue? And I didn't think, like, I'm not outside all day. But even going from like your house to your vehicle and then driving, you're still exposed to all that sun, right? So I was like, okay, well, when I wasn't wearing sunblock, I started to get like, it's like just red patches. And I'm like, man, it's from the sun. It's from being out in the sun. So when I started wearing the SPF 100, oh yeah, that stopped completely. And now I'm like, okay, I don't look like I'm burning every time I go outside. So I recommend that SPF 100, not SPF 50, SPF 100. May as well go all the way. Protect yourself. Charlotte says, I'm in Oklahoma and we've had a heat wave as well. Finally getting a break. It's nice when there's that break with like rain. And we didn't get rain, but I know down in Round Rock they got rain a couple of days ago. And I'm like, man, I'm so jealous because rain would be really nice here. And it's just like, but it's the second that it rains, the ground is so dry that it just soaks it right up. And it's gone. It's like it evaporates. And it just never rains long enough, you know. So I'm really hoping that we're going to get some rain soon, because these poor animals out here too, they need the rain. Miss says, fellow Texan here, it's 100 degrees every day. Looking forward to the cooler temps soon. They can't get here fast enough. You know that, right? And rain makes it so muggy. It does. It really does. Especially if you're in an area that has high humidity. I'm not in such an area, thank goodness. But I used to live in a place that had a lot of humidity, and trust me, I was just like, ugh. Whenever it would rain, I was just like, man, I know it's gonna be like super muggy and mosquitoes, and I don't do mosquitoes, okay? I don't do bugs or at all, but that's when they like to come out. It's right after the rain. So hopefully we get rain, but no bugs. That'd be great. But so. Is anybody getting ready to take their test? I think everybody in here that I recognize the names, y'all have either already tested. Yes, the little vampires. Y'all have already tested or you're going to test. Anybody going to test soon? I do not have any tests myself on the horizon. I had enough from last year. Regina, I took it and failed by 2 points. Ooh. Which one did you take? Was it with a HEMA or AAPC? Miss says not yet. You're still studying though, AAPC. Are you planning on retaking it, Regina, or are you going to wait a while? The CPC. Are you going to wait a while? Because I think the waiting period is what? 30 days? But I always tell people, if you fail it and you want to retake it again, I know the temptation is to take it at the 3-month mark. However, I recommend a little bit more time, like at least 4 months. Even if you failed it by 2 points. The reason that I say to go a little bit longer, like at 4 months, is because you're going to need that extra month, because the first month after like not doing well and failing a test, you're going to have to kind of work through that. And while you may be gung-ho and getting back into the books, you're still going to feel that little bit of like, man, and so I always say like that first month is like kind of like the getting yourself back into the groove type month. Like you got to replan and re-strategize and figure out what went wrong. If it was that you were rereading the questions and taking too much time on a question, or that you may have failed in a certain subject that was a little bit harder for you, at least that's where you really need to kind of concentrate and study. The great thing about going in for a second attempt is that you already know what to expect. And sometimes if you are failing, or if you failed, it's because sometimes it's the person. It's not anything to do with their knowledge. It has to do with the person. And I've seen people, and I'm the one who gets the upset emails, and they yell at me because they failed. And I know it's not me personally. It's just the fact that they're frustrated and they're like, why can't I pass this test? And I can't answer that question because there's many reasons why people fail, and sometimes it's not that you're not competent. A lot of times the person is, but then when they sit there and they start second guessing and thinking and overthinking, and then all of a sudden the pressure builds up, and then that's what messes them up. So you really kind of want to look at, okay, how was I feeling? Did I cram? Did I, did I do all the things that Blue tells me not to do? Which is study all the way to the last day, sometimes the morning of, and then attempt to test. There's very few people who can do that. I never recommend doing that. I always say to give yourself a couple of days before, so that way you can rest and be refreshed by the time you get to that exam. I recommend a week. People say that that's too long. 2 to 3 days then. At least that's something. At least you get a break, because then you'll be ready to go when you take that test, Regina says, yes, at some point, but yes, I am planning to wait. Liz says, I'm sorry, Regina, and I'm sure you will do well the next go round. I agree. And Regina says, I agree. I think 4 months is wise. Yes. Liz, the other Liz, says, no, I'm 3 weeks into a self-paced program. Yay! I won't finish until next year and take the CPC exam. Excellent. Regina. Another Regina. So I got 2 Reginas and 2 Liz's. CPC is a difficult test. Didn't pass the first time either. Liz says, Blue, I wanted to ask you a question about Patreon, but don't want to put you on the spot. Okay. Go ahead. Because you can't leave a cliffhanger like that, and I'm just like, you gotta ask the question. Now I gotta know. The CPC, it can be a difficult test, especially if you, especially with the speed in which you were trained. If you went and you skipped anatomy and medical terminology, you skip those courses and you say, okay, well, just give me the course, the 4-month course, and yeah, they say they can train you in 16 weeks, and then you go and take the test. Oh yeah, that test is going to be really difficult. Oh, is that what you're, Liz? Okay, what Liz is talking about here is she says, I'm torn between the resume and the, and the 3 1-hour sessions. Okay, so what Liz is talking about is on my Patreon channel. If you sign up for a year on the $10 a month level, $10 a month pledge, if you don't know, Patreon is a lot like YouTube, except that you pay to support the creator, which would be me. And you get access to all of the coding quizzes and the word search finds and the crossword puzzles and everything. The videos that I post about myself, the slide decks, and I've been doing like study hall once a month. I do have a guest speaker. I'm so excited. Brandon, the Gen Z coder, is going to be speaking on shoulder surgeries. So he's going to be going into that, and that'll be next month in August. So if you are interested in signing up for my Patreon, it's better if you sign up on the 1st, because Patreon charges people on the 1st. So it doesn't matter when you signed up. If you sign up on the 20th, it will charge you again on the 1st. If you sign up on the 25th, it will charge you again on the 1st. So whatever you do, just make sure that if you're going to sign up for Patreon, then you can do that on the 1st. I don't expect people to stay, but if you sign up for a year, you can sign up for a year, and of course you get a discount for the monthly thing because you're paying all up front right away. But I do offer 2 bonuses, the choice, one bonus or the other bonus. And so one is a resume rewrite. So if you sign up for a year, you get a resume rewrite included in your package. Or you can choose 3 one-on-one sessions with me. And now my tutoring rate right now is $35. So, that's it's still a good deal because you're on Patreon. But you get 3 hours with me. So either way, the resume rewrite right now, the rate is $125. So it's whichever one you want to pick. If it's important to you to get a resume rewrite, then that's fine. If it's important for you to have more one-on-one time with me, and you want to wait later on and see about writing your own resume, or if you want me to do it, you can certainly schedule that later on. But yeah, it's just a choice, whichever one you want. I tried to do something for people who have supported me in that. That money goes to my education. So that's why I say, if you want to subscribe for a month and check it out, and then not just subscribe the next month, that's totally fine. It's no hard feelings, trust me. I'm just grateful and thankful that people even subscribe to my Patreon, because that's not something that I started out the channel doing either, right? So there was an audience member when I first started YouTube that was like, hey, do you have a Patreon channel? You should really start to have a Patreon channel. And this guy was like on me. I'm like, fine. I don't think anybody's gonna support the channel, but whatever. I'm like, okay, fine. So so I created the channel, and then it just kind of like took on a life of its own. So it's just like, okay. So now I have it, and I try to make sure that I post, regularly, and I do videos and stuff like that. So, and if you subscribe, you're still getting access to all the content that I posted. So anybody who subscribes right now, it's like a gold mine of like content, practices and everything. So I don't know. That's just what I would have to say. But yeah, so yeah, you do get an option of that. The higher levels get more one-on-one time, so it's whatever you want to do. Z Marie says, do you have any tips for people who are working full time and going through the self-paced program? My apologies if you answered this before. So I did a video about study tips for busy people. So if you're working a full-time job, and I tell people, even if you're working a full-time 40-hour-a-week job, you can still manage to squirrel in 20 hours a week per study. Before you say, well, how do you do that? So the example goes, okay, if you have a half an hour drive to work in the morning and a half an hour drive home in the evening, that's 1 hour, right? So you can either listen to like crash course anatomy and physiology, just those videos. You can put it on your Bluetooth and listen to it in the car while you're driving. So that's 1 hour of listening time, because you're taking advantage of that, of that time that you're driving, right? And then of course you have your 30-minute lunch break. Now you can put your headphones in and you can still listen to videos about medical terminology and anatomy, and just listening to those things helps. Then that's already an hour and a half. Then you come home from work, right? You can squirrel in another 2 hours, right? But I was saying before is if you do 3 hours in a day, you manage to squirrel all that time in. Remember, you got that 1 hour. And then if you do a half an hour, all you just need is just the other time left. And so, an hour and a half after that. And so you can squirrel that in the evening when you put the kids to bed. You can just listen, and then you can start to work in the workbook. You can get your flashcards out. And it's 3 hours on that day for 5 days a week. That's already 15 hours you've squirreled in of study. And then you've got Saturday or Sunday, or Saturday and Sunday, to spread out 5 hours. And I always tell people, don't study for more than 1 hour at a time, especially as adults. We don't do well with studying for long stretches of time. We're not in high school anymore, people. We have car notes, house notes, and bills. Some of us have families, some of us, don't have families, but it doesn't mean that we aren't any less busy, so, but that's what I would do, is to do it that way. When I was studying for the CCSP and the CCS, I still managed to squirrel in that 20 hours a week of study, because I was literally taking the time to do it. And at the time, I was still doing live videos every night. And so it would be an hour and a half, sometimes 2 hours with you all. And then after the show, taking a shower and then studying for another, hour and a half, and then going to bed. And doing that repetitively the whole time, but still giving myself time off. But if this is truly a goal that you want to do, you will make the time to do it. And it will get easier with time as you become more disciplined. Making the time, putting up in your study area, like visuals so that you can see it. I talk about like how when we were in school and the teacher had the border up around the room, and it was the numbers and the letters. Why? So that you can constantly have that stimulus. It's the same thing when you're studying, when you're working full time and you're trying to study and do this independent pace, right? You have to put the visual stimulus around. So those anatomy posters that I recommend, they're great for that. You can print a lot of these things from the internet, so you can have them around so you can look at them and you can constantly see them when you're going in to study. So that does help there. And, just taking the time to just open the book and get familiar with it. This is a PCS book, yes. So if you're studying for that inpatient, one of those inpatient ones like the CCS or the CCA or even the CIC, even if you take the time on a Saturday to just flip open and look at all the pages, get familiar with the books, so that way you can practice and open up all these areas and you can see what the appendixes hold. If you're taking those exams, the CCS, the CCA, or the CIC, in the back of this book, in Appendix M, like in Mary, there's a whole list of all the sections, the medical surgical section and all these other sections, and it's just a bunch of different procedures that you can look up. And this is what I used to help me study for the CCS, right? Because I knew that I needed to work with this book because PCS used to be my nemesis. And so working with this and looking up the codes, that helped me just to practice. But I would do this for an hour, And I would work through, okay, I did 10. Okay, now I can do 12. And so you just build up your speed after a while. So and then in Appendix N, like in Nancy, you have all of the answers. So then you're able to look and see, okay, did I get the answer right or did I get it wrong? If you don't know how to look it up at all, I recommend going ahead and looking up the answer so that way you can reverse look up how did they get that answer. So that way you can kind of like tie words together so that you know how to arrive at those things. Because PCS, a removal, to me in my CPT head, is a removal, is a removal, is a removal. Not so with PCS. Oh no, they have to get extra with the way that they write things. Extirpation. Who says that? Really? So that's why I say practice, practice, practice. And if you spend that 1 hour, working through those, guess what? This means that you're practicing looking through the book and you're going to get faster at it. And spending that 1 hour or even spending 30 minutes looking through the book and trying to get to those is going to make you a lot sharper. You're going to know exactly where to go. You're going to know exactly what section that particular procedure falls under. Okay, so that you can do in here. Working with the CPC study guide, doing this, guys, it's broken down into the chapters. This is why I like this book, because it's so easy, because it's got those questions at the end of the chapter that you can work through. And I like the size of the op note type deals, right? It gives you plenty to read so that you have plenty to, like, okay, now you start to understand when you're looking at these op notes that you're going to be looking at the heart, right? The meat of the potato, which is towards the end, when they start talking about like what the final diagnosis is and what they found and what they did and that kind of thing. So once you start looking there, then you know, okay, that's for this procedure. You never want to take a procedure off of like procedure performed. You always want to make sure that it's going to be like what is described in there. Not that the AAPC book is going to try to trick you that way. AAPC is very good about being straightforward, right? They don't do the trickery. But at the same time, you want to make sure that you learn good habits. So you start looking at the bottom of the note and then you work your way up so you can confirm what you're reading, okay, by what you've read and what they're saying that they did. So again, you can work through this one. You can take the time to work through a chapter at a time. And so that can help you to, set reasonable goals. All right. So that's my advice there on that one. Let's see. What did I miss? Liz was laughing. Regina, when I pass, I like that. When I pass, I will reach out to you to do my resume. Thank you. Liz says it's definitely worth it. Ella, what? We don't talk about that. Queen C, hi. So I'll catch the replay. Okay. Liz, I know Blue. Blue. The crazy thing is that I don't have one PCS question on my exam. I was shocked. Oh, because you took the CCA, right? I think so. Yeah. And they say that because these questions are mixed up. So I always say it's a pool of a million questions. So you never know. Nobody's exam is the same. Some people have said that they have a good mix. And some people said just what you said, that they didn't have one PCS question. So it really all depends on how, this exam is coming together. Because that's the thing about HEMA exams, is that to protect the integrity of those exams, no two exams are the same. Alina, hello. Thank you for joining me. Thank you, Liz. Both Liz's. But yes. So that's what, hopefully, Z Marie, hopefully that helps you. I know it's a lot, especially like when you're working full time and you're not used to being in school. When you're not used to being in school, it's just like, man, now I gotta add this thing on here now too. And but if you're clearly wanting to do that because you clearly want to change what you're doing. You clearly want to change the trajectory of where you're going in life. And when you have that desire, that desire can propel you forward, and it can also give give you that strength when you feel tired and you don't want to go anymore. And you're just like, no, 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 no. I don't want to read no more. I don't want to listen no more. You know, it is possible when you do have that drive. That drive is what propels me forward all the time to do the things that I do. I talked about it the other night. You know, if you guys honestly knew what I do in my day, my schedule, your head would spin. And this is constant. And I constantly do this because it's moving the ball forward. It's still taking care of myself, but at the same time, it's honoring my need to fulfill these goals. And so I also have a responsibility here to the channel on YouTube and also to the channel on Patreon. You know, so those are the things that help me with my goals. When you feel like you're lagging when you're studying, you want to make sure that you have something that's driving you. In the times when I was tired and I was studying for these exams and I had these exams on my mind and I didn't share with you all, I didn't even share on Patreon that I was doing it either because I wanted this time to myself. I wanted to make sure that I was focusing on me and I was focusing on this test. And in the times when I'm just like, you know what, I don't want to do this right now. I'm just tired. I don't want to. Then I would say to myself, this is going to lead you to what you want to do. The CCSP and the CCS is laying the groundwork, and it's part of the foundation for what I'm going to do. And so because of that, I said, okay, if I want this, you know, I'm going to let all these people down if I don't do what I need to do. And I'm like, yes, but can I have a break? And I'm like, yes, I'm having this internal dialogue with myself. And so that's why I always make sure that at least once a month that I take a day where I'm not doing anything. At least once a month. I try to make it a little bit more, but I also try to make sure that I stay healthy and I stay like healthy, like mentally healthy. I'm not stressing out because the more that I do that, I'm not good to anybody else. But if I have this where I have this goal and I'm going to do this and then I meet that goal like I did with the CCSP, the first one, I was like, yes. And that's your drive right there. And coming here and being able to share that with all of you, that was great. My Patreons heard about it first because the money that they contribute to Patreon goes directly back into my education. And that's how I was able to pay for those 2 exams, plus all the materials that I needed to be able to prepare me. That I shared with all of you. So it makes me a better coder so that I can be a better coder for all of you so that you all can know. Because again, I'm not here to sell you anything. And I did get an email the other day. Yes, you are selling stuff. You have all these services. But that's not me sitting here going on and on about it. What I'm saying when I'm saying I don't sell y'all anything is I'm not trying to sell y'all on credentials. I'm not here to try to sell y'all a bunch of credentials that you don't need. I'm not here to try to sell you a fast-paced medical coding program that's 16 weeks that you could be on your way to a brand new career. I'm not here to do that. I'm here for the coder. I'm here for the coder to help the coder because at the end of the day, the coder is what is going to help the patients and the providers. I take it very personally when it comes down to the patients and the providers. Because if you select the wrong code, that patient has to pay either more money or less money. Now, if you dipped into the provider's pocket because the patient had to pay less money, but they actually should have paid more money, now that's on the provider. And you know, we are culpable for everything that we are selecting. You take the time to look at any of those articles that come out. Oh yes, medical coders do get called into court to answer. We do have to answer. These are legal documents. We have to answer people. So that's why I always say I'm here for the coder. This is why I don't talk about salaries. This is why I don't do any of that stuff because people sell the field based on money. And people hear that, they hear the money, and that's what they want to do. And that's why I don't talk about money because I don't want to be a part of that. I'm a part of helping the coder. I'm a part of helping people to learn more, to open their eyes so that they can see that it's not all this other stuff that people are saying that it is or that you need. There's some people that say, oh yes, if you have a CPC or if you have a CCS and you need a CPC. Really? Because did you know that the CCS says that you've mastered inpatient and outpatient? Then why the heck do you need another credential that says you already mastered the outpatient setting. Why? And not only that, you got to pay a membership fee every single year that you have the AAPC credential. That's not fair, folks. That's not fair. When it's an expensive field as it is, you need the money to be able to maintain for your CEUs. They already have it. They already have the CCS. Don't make them. Don't force them to do the CPC too. They don't need it. This is what I tell people. People get mad. I don't care, because I would rather y'all know the truth than to be filled with lies. Even though I'm often the one who says the opposite of popular opinion, and that's okay with me. At least y'all know if somebody told you. Z says it does. I just get so sidetracked with things, which is a huge issue with me getting back on track into school. Yes. Liz says, I agree with you on the Facebook groups. I find that sometimes reading the comments makes me more depressed instead of encouraged. Yes. Alina says, hi, Blue. Today I was looking at the AHIMA website, and there was a job posting that said that they don't accept CEU's courses. What? The AHIMA, okay. Today I was looking at the AHIMA website, and there was a job posting that said they don't accept CEU courses. Is it better to get a college certificate? No. Get a certification. The degrees or the college programs, they're the college programs, the RHA or RHT, those are for our leaders. If you want to be a coder, you need a certification. I'm not really understanding what they mean by they don't accept CEU courses. I don't get it. Liz says having services and pushing them are two different things. Thank you. Finally, common sense. I was just like, are you freaking kidding me? You provide a lot of valuable information you don't charge us for. Thank you. Thank you, Liz. At least I didn't say it. Liz said it. And I right? So, I don't know. People. But if you're making everybody happy, then you're doing something wrong. So that's why I always say, whenever I get something like that, okay, I didn't make somebody's day, so obviously I'm doing something right then. So waiting on Alina. Hopefully she can clarify what her question was. But yes, so staying focused and staying on track is very difficult if you don't have that drive. As far as you gotta that's what you have to do. It's something you gotta see every day. I can just tell you that having it in front of you every single day, what I would do is I would put my name with the credential that I want in a place where I could see it every day on my whiteboard. So as soon as I left the house, as soon as I came back in from work, I would see it, and that's how I did it. But it's a lot of self-propel, and I know a lot of people want to do that, and sometimes people will say that they use my videos whenever they come out at night as a way to kind of stay engaged with doing it. So if they know that my show's coming on, they know they better have done something, read something or something like that, because that's how they use that as a coaching tool, to stay on the course. So I mean, it's really hard, and especially if you're not going someplace, right? If you're not going someplace to tell you, hey, or you have other people around you that are like, hey, we're doing this too. It is really difficult. I have my Facebook page. I don't do much with it, but some people have gone on there, made comments and asked questions, and other coders will answer. I don't have a lot of people connected on Facebook, because I think you all know how much I don't like Facebook. So I have 138 people following me on the page, but you can always use that. I mean, it's up to you. It's hard. I mean, I get it. So, but it's up to you to get that discipline back. You just have to try your best and That's all you can do. You can set yourself on a schedule. Like if you say, well, I'm doing self-study, but I know by March, I want to take my exam. Okay, now you got a countdown, right? You got a countdown now. You've got till from August to March to get ready to take your exam. That's plenty of time, right? Especially if you're concentrating. And if you are doing self-study, you can go through the books. It's reasonable to be able to meet every single chapter and go through every single chapter, take one chapter at a time. If you want to do anything interactive, of course, you can always go to the AHIMA store and go to the a la carte where they have all the courses. They have them broken down into the different body systems as well. They have like covering, sometimes it's 365 days for that one course, and sometimes it's 6 months for the one course. You can replay it as many times as you like. Sometimes there's CEUs attached to it, but if you don't have a credential yet, don't worry about the CEUs. Everything that you earn CEU wise will not count towards your credential when you get it. It has to be, the CEUs have to be earned after you get your credential. Anything earned before does not count. People get mad, but it's true. And so they say, well, why do they have CEUs on there? Because some credentialed medical coders will do that. They will say, I need to do continuing education, but I want to do it for this specific thing. So I'll go ahead and purchase this course and it'll give me 5 CEUs. Okay, that's great. If you go through I don't recommend this for new people, but if you are looking at the boot camps later on, and I did the boot camp for inpatient coding, which helped me through AC Pro, and it was like 14 or 19 CEUs. One of them gave me 14 CEUs, and then I did a CDI boot camp. So one of them gave me 14, one of them gave me 19. I can't remember which one, but it was 14 or 19 CEUs when I completed it, and for AHIMA. So that was all in one sitting, and it was a boot camp, so I only had it for 60 days. So I had to go through all the material in 60 days. And so I was just like, I gotta hurry up. And I did that last year as well. So in between the CCSP and the CCS, I did that in between there. And that CDI boot camp, I'll tell y'all what. I thought that the inpatient coding boot camp was great. I was like, okay, this is great. This is a good pace, and I understand everything, and it makes more sense now. But when I got into that CDI boot camp, I had my keister handed right to me. I was just like, oh my gosh. I was like, I'm really gonna think of this one. And so yeah, CDI boot camp with AC Pro, no joke. But yeah, I did that one as well. So okay, wait. Here we go. Oh, I missed a lot. Did I miss a lot? I did. Liz says, I have a degree, but you still have to be certified. I went that route because I wanted to get a degree because I promised my mom I would get one. I sometimes wish I hadn't because of the huge loans. Well, but you still made your mom proud. That's all that matters at that point, right? Shalise says, Blue, do you have videos teaching how to code? I do, and those are some of the lowest viewed videos. So yes, if you are looking for any of those, you can check my old videos out. It's almost like 2020, and maybe some in 2021. But I don't do a lot of them anymore on the channel and I did an E&M one last year. I did E&M study hall. No, that was this year. I did E&M study hall. And again, low turnout, not a lot of interaction. So that's why I don't do it. I do it all on Patreon now because whenever I do demonstration videos or talk about particular topics, I did one Christmas in July a couple of years ago. It was all about the different specialties and how to learn more and things like that, and going over certain things, and nothing. Some of those videos don't even have 200 views on them. So I don't do all that stuff here. I do it on Patreon. So if you're interested, you can check my Patreon channel. But you can still check out the old ones, the old videos, where we talk about like sequencing and fracture coding, injury coding. Oh yeah, I've done those. Alina says, I will look at the post again. I may have misread the posting. Okay. Liz, oh, just as an FYI, if you join a HEMA with the student membership, you do not qualify for the free CEUs they offer under the regular membership. Wings says, hi Wings, which boot camp for IP is better? You can go through the one on a HEMA. It's not a boot camp, but you can learn the inpatient coding through the ICD-10 PCS. You can separately report. You can separately purchase that ICD-10 PCS course that they have there. And I don't know if it's 6 months or 365 days. Either one. You can check the HEMA store. The one with HC Pro is really good, but it's also very expensive. I think it's like $1,300, $1,200 or $1,300, give or take. So, a HEMA, APC, not APC, but HC Pro, either one. Liz, E&M, I have to search for that one. You're welcome, Shalise. Tangela, do you have videos on your YouTube about fractures or on your Patreon only? I missed that. So I do have the one about the fractures here. I have a couple of them, I think, about fractures. Because I was doing that, and then I got no engagement. And I also did, Quiz Friday, and I since took those videos off. Let's see, fracture. Wait. I have since took those videos off because, again, people don't watch them. I mean, I don't want to have content on here that y'all are not watching. So, I don't want this page. I'm going to the studio. Hold on. Fractures. Yep. One from 2018 and one from 2019. There's two of them here. Injuries. Yep. Patreon. Well, I was on Patreon. Understanding injury, medical coding, 23 minutes. And then injury aftercare for medical coding explained. I talk about like when you're coding for injuries, how you have to stay. So, and I just lost half my audience. But yeah, so it's there. I mean, all you have to do is type in injury or type in sequela or sequencing or any of those, and it'll come up. Let's see how many for sequencing. 7 videos on sequencing. One is a Patreon, but I do have medical billing and coding sequencing examples, sequela, sequencing tips for medical coding, sequencing tips for medical coding. Yeah. And sequencing tips. Yep, I got 1, 2, 3, 4. I got 4 videos on that. What else did I do? Tabbing the CPT, study tips, and then explaining the books. ICD-10 CM. I have an ICD-10 CM demo from 2021. ICD-10-CM book and diagnosis demonstration, and then I got study tips, and then I got the books explained, and then ICD-10-CM diagnosis lookup demonstration, and then back to the basics ICD-10-CM a book medical coding. So there's quite a few of them. Quite a few videos that I have. I mean, but I don't know. I don't know why people. I don't know why they don't watch them. um, okay, I need to review those. The fracture coding is killing me. But fracture code fracture coding is so fun. um, Liz says, I wanted to take a moment to say thank you for all you do for us. It is greatly appreciated. There aren't many AHIMA certified folks doing videos. Most of the ones I see are AAPC. Yes, that is very true. I'm one of a very, like, less than a handful of us. The only other one, I make it a point not to watch other medical coders that are on YouTube, because I want my content to be all what I say in my head. I don't want anybody else in my head. I don't need to go to other YouTubers for ideas. I have to think of my own. All right. So the only one that I did watch in the beginning was Kate, Coding with Kate. Now I like Kate because she's a nerd like me, and you can tell just by like listening to her. But Kate stopped posting videos a long time ago. She's a CCA, or was, I don't know where Kate is. Kate has still a cult following because she's still, her channel is still growing. I don't know what happened to Kate. But when I first started my YouTube channel back in 2018, I was like, are there any medical coders on YouTube? And I happened to stumble onto hers first. And so I was like, okay. But all the like content and everything else, this is all me. So, but yeah, that's what I did, But yeah, there's not a lot of us from AHIMA, and but AAPC does have a large grassroots movement, so that could explain why there's more AAPC folks out there. But I don't know. So, but I think because it's already 9 o'clock and y'all have had me for an hour and a half, that I think I'm going to go ahead and end on a very happy note. Thank you so much, Liz. I appreciate your kind words. That gives me the strength to keep on going and to keep making videos and helping you guys out, and just knowing that I'm out here trying to do things that are helpful to you all. And I hope that when you're studying, that that it's not always going to be fun, but there are ways to make it fun, like watching Crash Course Anatomy and Physiology. They also have Crash Course Biology as well. So that's another really good one, that gets into more of the organic type stuff, but it's still really good to know. There's a couple of other ones that I do recommend as well. JJ Medicine, not J and J. JJ Medicine is really good. So that's another channel that I do recommend. And, I try to post some things on the community tab, but for the most part, like, all of my recommendations go on Patreon. So they hear about it first. So, but I'm going to go ahead and wrap this one up. Thank you guys so much for joining me tonight. I appreciate it. This has been a fun chat, even though I know it was all over the place, but what else do you expect? It is Friday. So I hope you all have a great and safe weekend. Don't work too hard on your studies, and make sure you're giving yourself a break when you need it. Listen to your body, listen to yourself. When you are tired, take a break, rest, sleep, eat, and make sure you drink plenty of water, especially if you're in Texas or Oklahoma. Any of those states is getting pelted by this 100-degree heat. Liz says, thank you. Have a great night. Thank you. Thank you, Z. And all right, I'm going to go ahead and you're welcome, Regina. All right. So I will see you guys next time. Bye.